Hi, everyone. Welcome to Cannabis Prevention and Education in Minnesota, Triage Timeline and Longer Term Investment. This webinar is hosted by Public Health Law Center in collaboration with the Minnesota Regional Prevention Coordinators and with funding from the prevention coordinators. And this is the fourth in a series of webinars that we have co-sponsored, collaborated on over the last year on Minnesota's new cannabis law. And you can view those recorded previous webinars either on Public Health Law Center's website or the Prevention Coordinator's website. So next, before we kick things off, I do want to acknowledge that the Public Health Law Center is based out of St. Paul, Minnesota, and we acknowledge our presence in the tribal and treaty homelands of the Dakota peoples since time immemorial. This land acknowledgement we have on the slide right here was developed by the Native American Law and Sovereignty Institute at Mitchell-Hamline School of Law, which is where we are located. And it is being used with their permission. So I want to kick us off by introducing our amazing panelists today. We have just an incredible expertise and information to share with you today. So we have Traci Toomey. Dr. Toomey is a behavioral epidemiologist and professor in the School of Public Health at the University of Minnesota. She is an expert in substance use control policies and has served as the principal investigator or co-investigator of nearly 40 externally funded research studies focusing on substance use. Dr. Toomey is the director of the new University of Minnesota School of Public Health's Cannabis Research Center. She is also the director of the Alcohol Epidemiology program at the U of M. Kara Skahen serves as the project director for the Minnesota Prevention Resources Center. Kara has worked in public health prevention for over 12 years, primarily in commercial tobacco prevention. Kara is also a program director for the Association for Non-Smokers Minnesota, where she leads smoke-free housing policy initiatives and provides tobacco prevention policy support nationally. Kara has a Master's of Social Work and a Master of Public Policy degrees from the University of Minnesota, Twin Cities. Harrison Fontaine is the Policy and Program Manager serving as the Cannabis Subject Matter Expert and Legislative Lead for the State of Washington's SUD Prevention and Mental Health Promotion Services section of the Healthcare Authority, Division of Behavioral Health and Recovery. That's a mouthful. He is passionate about policy level changes to support equitable health systems and the health of Washington's youth. Harrison obtained his bachelor's degree in biology and human physiology from the University of Oregon, followed by a PhD in addictions neuroscience from the University of Washington. He joined the Healthcare Authority in 2022. Palvinder Kaur has a doctorate in education and a master's in public health. She is the senior program officer at the Sierra Health Foundation and works with the Elevate Youth California program, which is a statewide program addressing substance use disorder by investing in the youth leadership and civic engagement for youth of color and 2S LGBTQ plus youth ages 12 to 26 living in communities disproportionately impacted by the war on drugs. So, and a quick intro about myself. I'm a lead senior staff attorney at Public Health Law Center. I do much of our work on commercial tobacco in Minnesota, but also a substantial amount of work on public health impacts of cannabis legalization in Minnesota. So I'm going to shift over to some details about what was actually included in the state law for education and prevention. And so this is just a quick snapshot just to kind of give you an overview and kind of timeline of when some of these resources have become or will be coming available to all of you as prevention experts. First, Chapter 63 is the law that embodies our cannabis legalization for adult use recreational cannabis. In that law, there were a number of appropriations. Beginning July 1 of 2023, there were appropriation of $180,000 to Minnesota Department of Education for school and districts around cannabis substance use resources. $2.5 million to the University of Minnesota for the Cannabis Research Center, which Traci is going to tell us more about. And then there was $5.5 million for the Office of Cannabis Management to establish and operate a treatment, recovery, and prevention grants program under a new section of state statute, section 342.72. So those resources, to my knowledge, have not been distributed or coming online yet, but we will know more in the future from the Office of Cannabis Management. So moving on to the next slide, beginning July 1 of 2024, so this summer, there are additional appropriations that will be coming online. The law allocated $5 million to Minnesota Department of Health for youth education grants, $2 million to the Minnesota Department of Health for education grants for pregnant and breastfeeding individuals, and then another $10 million specifically earmarked for local and tribal health departments for cannabis education programs. And the next slide, for future funding, the Office of Cannabis Management was asked to or required to make recommendations on funding on an annual basis to the legislature. And so they just came out with their report and recommendations to the legislature in January. They did not make any recommendations for changes to those allocations of funding that I just mentioned. So there's no new information there. But I wanted to acknowledge that that is one role for the Office of Cannabis Management, is to make those recommendations on funding each year. So, and my last slide I want to share with you is just an overview of some resources that will be required by the Minnesota Department of Education. They are required to develop some model programs in the next several years. My editorial comment is it's unfortunate that some of these resources aren't available before the legalization and before the sale of these products. We are grateful that Minnesota Department of Education will be developing these really important research resources in the future. And so with that, I would like to hand things over to Dr. Traci Toomey, to talk about the new Cannabis Research Center. Traci.
Thank you, Rachel. I'm really pleased to be here today to talk about the Cannabis Research Center, which is newly developed. I started in my position on October 2nd, and it has been a whirlwind ever since then, trying to get the center up and running. Next slide, please. As Rachel said, there was an appropriation by the state legislature to develop this center. It was an appropriation to the School of Public Health at the University of Minnesota. Our charge is actually very simple and very broad. The center must investigate the effects of cannabis use on health and research other topics related to cannabis, including but not limited to prevention and treatment of substance use disorders, equity issues, education, and decriminalization. So we are certainly exploring all of those areas, and as well as other issues related to cannabis. Next slide, please. As we developed the idea for the Cannabis Research Center, we've identified three primary functions that we are focusing on. The first is to engage and collaborate. We really want to build collaborations with state and local agencies, community-based organizations. We really want to hear what are the research questions that organizations and citizens have around cannabis, and then kind of work together with a variety of different partners to determine which are the priorities and which are the ones that are feasible for us to answer now and moving into the future. Our second function is really the heart of the Cannabis Research Center, which is to promote, conduct, and disseminate research. As I said, as we identify research priorities, we want to conduct that research. It's an amazing opportunity to have money to actually do the research. So often people over the years have asked me, like, can you look into this or look into that? And it's like, well, if I can get funding from NIH or CDC in 2 years, maybe I can start to answer it. We now have funding to start to do research on a variety of topics right away. We will also be hopefully summarizing some of the research conducted in other places, not just our own research, and trying to disseminate that information to those that are interested in it. We also will have a third function, which is to recruit and train future researchers and evaluators that want to focus on cannabis. That function is going to be kind of limited to begin with and then expand as we develop our research program. Next slide, please. I'm the director of the Cannabis Research Center. Rhonda Jones-Webb is the Associate Director of Equity and Engagement, which is going to be a significant focus of the CRC. And Darren Erickson is the Associate Director of Research. Next slide. Phase one of our website, some of you may have seen it. It is not the most beautiful website, but we had to get up content in about a week, and within a month, we wanted to have at least the early structure of our website. If you haven't seen it, please check it out. We did put in some Q&A so that there's some summary of some of the research to begin the dissemination of some of that information. We also list our existing cannabis research and publications, as well as other substance use research that we have done in the School of Public Health. We will continue to update that information as we develop it. We're starting to develop some research briefs, and I'll talk to you in a few minutes about other ideas that we have for our website. Next slide, please. The creation of the CRC is fairly time-consuming. We plan to develop. We're developing our team with our staff and faculty members. We will eventually develop advisor groups who will guide some of our priorities and decision-making. We're working on building our collaborations, reaching out and meeting with as many people as we can to start to build those collaborations, identifying researchers who are interested in cannabis or people who have expertise that we can pull into the cannabis research world. We're starting to review key research literature, and we're planning on thinking about how to disseminate some of our findings from that work, identifying existing resources so that we're not duplicating effort. A really important part of our work right now is identifying existing data sets. There are significant limitations to the existing data sources that are out there, but we at least want to identify what are possible sources that will allow us to answer at least some questions. And where possible, where can we influence the data being collected in the future to ensure that it's as good as possible for doing research, but also helping people in the field that are doing the work around prevention and treatment. And then finally, we're beginning to conduct and fund research studies. Next slide, please. Some of the collaborations are within the School of Public Health, across the University of Minnesota, various state agencies like Minnesota Department of Health and the Office of Cannabis Management, working with the local Public Health Association and specific local public health agencies. We've connected with people at Mayo and Health Partners, advocates, and community organizations. Next slide, please. We're trying to develop a database of data sources. As I said, we're building a contact database so that when people contact us, we know who to refer people to, a slide deck so that when we are reached out to, we can actually go out. A variety of people in our group can do presentations for organizations, both in the community and for the state. And then we're going to make sure we evaluate our own work. Next slide. Early in our planning stages, we started to develop this model, which would help guide the possible research topics that we might answer or collaborate with or recommend to the field to answer. I looked at this the other day, and I've already identified some things that need to be added. So, for example, effects on specific groups. We should have included the LGBTQ plus community. We are interested in looking at products and some of the issues around the THC products. But you can look at this and see that there's a variety of things around prevention, screening, intervention, and treatment, looking at specifically at the different types of use, looking at various health effects. We're going in assuming that we might identify positive health effects as well as negative health effects. And then there may be looking at the economic costs and benefits. And then again, looking at very specific subgroups. Next slide, please. Our vision for our research portfolio is that we will fund some small grants. This is to engage researchers within our school as well as across the University of Minnesota. We also plan to do internal research, which is our core team, and this will allow us to be responsive as we identify priority research questions from our partners and other collaborators or from community members to try to get that research done. And then we will continue to apply for federal funding to do larger studies, hopefully getting funding from NIH and the Centers for Disease Control. Next slide, please. Just to highlight, we have already put out one request for applications for research conducted by faculty members at the U. We're hoping to get some applications March 1st this week. We'll see what we get, but it's for projects up to $50,000. Next slide. We'll soon release a small grants program for students at the University of Minnesota, up to 10,000 apiece. So again, we hope to generate research and ideas that may lead to larger projects down the line. Next slide, please. Some of the project plans and ideas that we have for internal research to begin with, just trying to launch ourselves into some of the research. We're about to launch a survey of local public health agencies just to get a sense of what local public health agencies are dealing with currently, what are the priorities for training and technical assistance. If you are from a local public health agency, please, if you receive the email, please complete that survey so we can get that information out to others. We would like to do interviews with law enforcement agency agents and district attorneys, a scoping review of issues related to equity. We're going to conduct a second state fair survey. We did one last year. We want to look at changes over time. So we've been approved to do that survey again this August. Next slide, please. We will be doing focus groups of college students. We're looking at secondary data analyses of existing state and national data sets. We hope to do scans of the retail environment, building off some work that we've already done and collaborating with others who will be doing scans. And then finally, we may do a national law enforcement survey as well. Next slide, please. We definitely want to get input from everyone about best ways to disseminate our research findings or findings from other researchers and what products would be helpful. We have the Q&As on the website. We'll be doing briefs. We plan to do fact sheets, summaries of research summaries of research findings, maybe educational sessions. Maybe there are webinars or podcasts that may be helpful, community presentations. And then, of course, we want to disseminate research through scientific articles and presentations. So definitely open to getting messages from you, letting me know what you hope for, what would be on your wish list, or having conversations following this webinar to have some of that guidance would be terrific. Next slide. And that's it. And if there's time, I'd be happy to answer specific questions when the opportunity arises today. Thank you so much.
Great. Thank you, Traci, for that great information. And we may have time for a few questions towards the end here, so we'll stay tuned. Next, I'll hand it over to Kara Skahen from the Minnesota Prevention Resources Center.
Wonderful. Thank you, Rachel. And thank you to the regional prevention coordinators and Public Health Law Center for putting on this webinar today. Again, my name is Kara Skahen. I am the project director of the Minnesota Prevention Resource Center. I'm going to be providing a very high-level overview of some pre-existing cannabis prevention resources that are currently available. I just wanted to emphasize that this is by no means a comprehensive list, and I encourage folks, if there are any resources that I missed, to please add those to the chat so that we can all learn from each other in this ever-changing issue area. So for folks that aren't familiar with the Minnesota Prevention Resource Center, we are a small but mighty team. It is myself and my colleague Madeline Bremmel. We are based out of our host organization of the Association for Non-Smokers Minnesota, based in St. Paul. MPRC is one provider within a network of substance misuse prevention support throughout Minnesota. So, Minnesota Prevention Resource Center, we provide a lot of great resources. For example, we have an online resource directory, also a digital book collection that is available for anyone to access. We provide a number of ongoing substance misuse prevention trainings throughout the year. We organize Minnesota's annual Minnesota Prevention Program Sharing Conference, which occurs every October. So just a real quick plug, this will be our 50th anniversary this year, and our conference will be held in St. Cloud, Minnesota, and I encourage all of you to join us. As I mentioned, MPRC is one provider within a network. We are also joined by Substance Use Minnesota, SUMN.org. SUMN provides the data to help local communities provide direction to their substance misuse prevention work, provide talking points to decision makers, kind of figure out where to go. Excellent resource for you. And then again, as you have already heard, the regional prevention coordinators provide the boots on the ground technical support. There are 8 regional prevention coordinators throughout the state of Minnesota, and they can help you figure out, who do you need to get at the table, how do you get that action plan going, and how can you evaluate the work that you're doing in your community. So really great resource. So we like to think that all of those 3 powers combined, in addition with all of the excellent work that all of you on this call are doing, that is what brings us successful prevention efforts in Minnesota. Next slide, please. So I'm going to start with just talking about a few national toolkits. One of the most popular that you've probably already heard about is Stanford Medicine's Cannabis Awareness and Prevention Toolkit. This is theory-based and evidence-informed. I do want to highlight that this is a curriculum that can be used with youth. I know that is a question that we receive a lot. And there is, I believe, a translation in Spanish as well, if there are any additional language needs. But really excellent toolkit can be accessed through the URL on the screen. Next slide, please. Another popular national toolkit is from SAMHSA, Preventing Marijuana Use Among Youth. This covers programs and policies to prevent marijuana use among youth aged 12 to 17. In addition to reviewing curriculums, the SAMHSA toolkit also gets into environmental and policy systems and environmental changes. So some of these include regulating the price of marijuana products, where these products are sold, the products themselves, and their promotion and advertising, and about how those policy tools can be used for prevention as well. Next slide, please. The next 2 toolkits I want to highlight are from the Prevention Technology and Transfer Center, or PTTC. The first is from the National Hispanic and Latino PTTC. They have a cannabis prevention toolkit, again, specifically looking at prevention among Hispanic and Latino youth and adults. The other wonderful thing about this toolkit is it is available in English, Spanish, and Portuguese. So really excellent. Again, if you're looking for any toolkits that are available in alternative languages other than English. Next slide, please. Another PTTC toolkit is out of the New England PTTC. They have the micro-learning toolkit. And so this is a series of short lessons on cannabis and on prevention. Each lesson consists of a video followed by a brief quiz on a whole range of topics, as you can see, differences between different cannabis products, effects of cannabis consumption on the body and road safety, and the role of prevention in cannabis policy decisions. I also want to highlight that the PTTC has a really great cannabis glossary with a variety of different cannabis-related words. It can sometimes be hard to understand all the jargon, so another really great resource. And they also have just a wide range of trainings as well on different prevention topics. So great resource there. Next slide, please. For folks who are interested in higher education, the Coalition of Colorado Campus Alcohol and Drug Educators have a toolkit, and this is specifically, again, for higher education. So it takes the participant from, conducting assessment, building on campus capacity, implementing prevention-based programs and evaluating those programs. So great toolkit out of Colorado. Next slide, please. Few local resources I want to highlight, and I just want to give a shout out. I know there's a number of folks from local public health on our webinar today. Local public health are increasingly, rising to this issue and seeing what they can do to address this as well. I know Hennepin County has a number of resources on their website. Dakota County has put together a really great fact sheet about cannabis use and prevention. So I want to encourage folks to, again, reach out to local public health and see what resources you may have locally as well. We've already heard from Dr. Toomey about the great start of the Cannabis Research Center. I just wanted to highlight them as well as a really wonderful resource coming down the road as well. Next slide, please. I have here resources from Minnesota Department of Health. I also want to call out, I should have added the Office of Cannabis Management as well. There are increasingly a number of really great resources listed on both of those two state agency websites. This is just a sampling from the Minnesota Department of Health. So some fact sheets on cannabis in your health, preventing unintentional poisonings, a really important thing that we get a lot of questions about. And then also people have questions about, where can I submit complaints if I feel like there are products that are being sold illegally or being sold in ways that are against current law and the newly implemented state law. So there's a complaint form on the Minnesota Department of Health website. Again, on the Office of Cannabis Management, a lot of great resources about the current law. You can request a speaker to come and speak and answer questions directly as well. So great resources from those state agencies. Next slide, please. Just a couple of local resources that are coming soon. The Minnesota Department of Education is putting together school guidance that will be released in the near future. If there are any questions that folks have specific to schools and education and that school guidance, please feel free to reach out to Lisa. I have her permission to share her contact email there. I also wanted to highlight that there is a toolkit specifically it's kind of a three-part with different modules, both parents, youth, and adults. This is a toolkit that was put together by the Minnesota Prevention Alliance and then also Smart Approaches to Marijuana Minnesota. And if there are questions about that toolkit, feel free to reach out to Ken Winters. His email is listed here. Next slide, please. I also wanted to highlight League of Minnesota Cities has a really great FAQ on their website. Again, frequently asked questions regarding Minnesota's new law on adult use cannabis and how that impacts cities and laws that cities are discussing whether or not they can implement. So next slide, please. A few trainings in addition to the toolkits above, just some from a more general education standpoint. Partnership to End Addiction. This is a national organization. They have an excellent collection of educational resources covering the basics, prevention, risks of use, treatment, and advocacy can be accessed at this website here. Next slide, please. Health eKnowledge. This is an online platform that has a number of free trainings specific to cannabis prevention as well. Everything ranging from pharmacology, preventing underage use, state policy efforts, and creating effective social norms campaigns. Really excellent resource. Next slide, please. We've already heard about this webinar series. I just wanted to highlight those really excellent past sessions that the Regional Prevention Coordinators and Public Health Law Center have put together, and they can be found on the Public Health Law Center website at the URL on your screen. Next slide, please. Dr. Jason Kilmer is also well known in this field for his work on substance misuse prevention and cannabis. He has some webinars that are up on YouTube as well. This one is particularly about cannabis research and the dangers of high potency cannabis and its harmful effects on developing adolescent brain. So great presentations available for free on YouTube. Next slide, please. Just a few newsletter things I wanted to call out. The Office of Cannabis Management has the Cannabis Implementation Insider, which is available at this link on the slide, provides updates on where they are in the the implementation process, and also provides opportunities for the public to weigh in. The last public rulemaking survey is open currently, so I encourage you to check out their website and also to complete that survey. Just to plug for our own Minnesota Prevention Resources newsletter, we have a monthly newsletter that goes very broadly throughout Minnesota, but we like to include all of the cannabis-related updates that we hear about in that newsletter. So please sign up for our newsletter as well. And last but not least, Star Tribune has a weekly news roundup on the legalization process. So if you just kind of want to keep your ear and hear what the buzz is about cannabis in and around Minnesota, that's a great newsletter to follow. Next slide, please. There's also two current virtual conferences. One is the Cannabis Action Conference. This actually just occurred in January, but I believe it is an annual conference. And then the Stanford Medicine Teaching Cannabis Awareness and Prevention Conference. That is happening next month, and that is also an annual conference. So two great virtual opportunities for you. Next slide, please. Public Health Law Center, again, another shout out for them. Great policy resources on this topic. There are two listed here that can be found on their website again. Next slide, please. I also want to highlight Getting It Right from the Start out of California. They have model ordinances, research, legal analysis, technical resources, and public health input all on this topic as well. Next slide, please. Few random additional resources from the federal level, Centers for Disease Control and Prevention. The U.S. Surgeon General has an advisory about marijuana use. SAMHSA has a number of advisories as well. And also the National Marijuana Initiative has a number of trainings on cannabis prevention. Next slide, please. And I look forward to taking questions at the end. Thank you.
Great. Thank you so much, Kara. That you did a lot of work tracking down all those fabulous resources. So next up on our agenda for the webinar today, we have two guests from outside of Minnesota. The good news is we are not the first state to have legalized recreational adult use cannabis, and so we are able to learn from our colleagues from other states. So first up, we have Harrison Fontaine from the state of Washington, and he's going to talk about some of the prevention resources and approach that they have taken there in the state of Washington. So Harrison, I'll hand it over to you.
Awesome. Thank you for that. So I am joining you today from Washington State, where cannabis has been legal for almost a decade now, a little bit more than a decade actually. And so I'm going to talk a little bit about how that has looked in our state, perhaps some lessons learned, as well as our prevention programs, services, and all of that good stuff. Next slide, please. So in this presentation, I'll be using the term cannabis rather than marijuana. Just really quickly, a word about words. Marijuana, is associated with a long list of racist and discriminatory policies, whereas cannabis can be sort of seen as industry's attempt to normalize and impact perceptions of cannabis use among the public. In Washington in 2022, a bill was signed into law requiring a change in statute from marijuana to cannabis, so that's what I'll use today. So like I said, Washington legalized recreational or retail cannabis about a decade ago in 2012. Retail stores opened in 2014, and several major changes have happened since. In 2016, there was a merging of the mostly unregulated medical market with the regulated system under Initiative 502, which is what legalized retail cannabis in the state. It also changed the way that cannabis was taxed. So instead of being taxed at each step along the process, there was a 37% tax on the final retail product, which is among one of the highest in the nation. Other notable changes are the development of a social equity and cannabis task force and social equity program that was stood up in 2020 and has been bolstered in many years since to address historical injustices of cannabis policies and enforcement in the state. Next slide, please. So before discussing prevention programs specifically, I wanted to address first a few policy issues that have been discussed recently in the state, as they're likely going to be also relevant to you folks in Minnesota. So in Washington, access is partially controlled by a cap on retail licenses. This is due to a lot of different reasons, partially concerns that retail stores have negative outcomes, may have negative outcomes on the surrounding populations. Publications from the nonpartisan Washington State Institute for Public Policy, as well as other groups, have shown correlations between the proximity and density of retailers and some youth behaviors. A chart on the right here shows data from a recent report showing that rural high schools especially report lower on-time graduation rates after a retailer opens nearby. The statewide cap is currently in the 600s. It's been revised upwards in recent years, and the newly added licenses are going to be distributed to applicants of that social equity program. Also, the state's Liquor and Cannabis Board regulates advertisements clearly to their potential effects on youth through increased normalization and decreased perceived risk, among other things. Nearly every year, including this year, legislation is introduced to either loosen those regulations at the state level or turn over aspects of those regulations to localities. Lastly, labeling and packaging is critical, as we heard, to prevent unintentional use and also inform consumers about how to use cannabis in appropriate serving sizes. Let's go to the next slide, please. Okay, so an emerging policy topic that we've touched a little bit on so far is that of high THC products. These products, things like oils and other products that have nearly 100% THC, occupy a lot more of the market, at least in Washington today, than they did in 2014 when stores first opened. And that's in addition to the rising concentration of THC in flower. Evidence suggests that youth are more vulnerable to the risks of these high THC products, and that's in part because the brain is still developing until you're about 25, like we know. We also know that youth that begin to use during their youth are more likely than adults to develop a cannabis use disorder. And then also cannabis-induced psychotic disorders are a concern and something that is beginning to gain focus in Washington. Population studies suggest that cannabis can play a role in triggering psychosis in vulnerable populations, and this effect seems particularly strong among youth and young adults. Young adults, Latino, and low-income populations, at least in the state of Washington, are the most likely to report the use of high THC products, and for this reason, they're at elevated risk for these negative outcomes. Following multiple legislatively mandated reports in the state, Washington has now 2 bills that are progressing through the legislature this year, dealing with this issue by increasing point of sale information, developing public health campaigns aimed at vulnerable groups, and then also studying how to implement an increased tax on these higher THC products to begin to discourage the use of these higher THC products and reduce youth access. And we know youth are particularly price sensitive, so that's a strategy there. Next slide, please. Okay, so lastly, in this sort of policy space, there are, of course, other commercial forces that have led to the emergence of other THC products with potential public health impacts. One of these is Delta-8 products and things like them. These semi-synthetic THC products came onto the scene, at least in Washington, around 2018 due to a federal law. And these impairing products were sold outside of licensed retailers. 2023 legislation in the state required these products at least products that contain any detectable amount of THC, to be sold at licensed retailers and prohibited the sale and the production of semi-synthetic THC products. Just last week, the state is in session right now. So just last week, the legislature passed a bill loosening the restrictions on a relatively new set of THC products. These are low concentration THC infused beverages, and they're regulated now a little bit differently than others. This bill essentially would allow for the purchase of dozens of individually packaged beverages at once. Sort of think those like mini nip, the mini liquor bottles that we can see and are accessed quite often by youth. And this is obviously a potential public health concern for its potential for diversion, as well as the fact that we know these products do appeal to youth. Okay, so next slide, please. Moving a bit from policies and products to surveillance. Surveillance in the state is critical to understanding where we are currently with use trends, looking at long-term trends in terms of use and behavioral health, and looking at the effectiveness of interventions. The Healthy Youth Survey is the main tool we use for this, and it is funded in the state by dedicated cannabis account revenues. It is a very large survey that's administered through the schools, and we've had more than 200,000 students fill out the survey in recent years. It's a collaboration between the Healthcare Authority and several other state agencies, and has really helped us sort of guide how we think about what's going on with youth use within the state. We've seen that since the passage of I-502 and the legalization of retail cannabis, that the actual use among youth has not changed, but we do see decreases in perceived harm. Next slide, please. A complementary set of data comes to us from the Young Adult Health Survey. It's a mouthful. And this is a partnership with the University of Washington, also funded by our dedicated cannabis account. And this looks at trends among 18 to 25-year-olds, another really important group to look at. And what we see there, essentially the key takeaway is that, well, use among 18 to 20-year-olds is not increasing. Use among 21 to 25-year-olds is spiking significantly. This is important for a few reasons. We know that this group is most likely to use, among the most likely to use high THC products, and also among the most likely to experience negative effects from those high THC products. Okay, next slide. So finally, beginning to look at direct prevention services that are funded by, at least in part, by our dedicated cannabis account revenues. These are sort of put into three different buckets, you can think of it. So we have these direct prevention services that are funded by dedicated cannabis account funds, but also that funding is leveraged by discretionary grants and block grants to get money and funds and services to our highest needs communities. At the core of these services is something called CPWI, which is our Community Prevention and Wellness Initiative, another mouthful. This is key to getting resources, again, to the highest needs communities throughout the state. And to do this, we use a data-informed process to get funding to those communities. Funding for these CPWIs also supports a community coalition aspect, building and implementing locally driven prevention, strategic prevention planning, as well as school-based implementation of prevention services. Another bucket is our community-based organization initiative, which is currently funding 21 CBOs and over 32 high needs communities. And similarly to CPWI, we prioritize high needs communities for these funds. We also coordinate with tribal nations throughout the state. The HCA provides funding and TA and other services to 27 federally recognized tribes throughout the state to implement programs that are specific to tribes' needs, their cultures, and traditions. Interestingly, this year, many tribes are beginning in the process of implementing something called the Icelandic prevention model, which is a model that's gaining some popularity and is doing some really innovative new work in that space. Okie dokie. Next slide, please. So one question might be, how do we evaluate community need to inform which communities really get this, get these services, get these CPWI communities and this help? To do so, we generated a composite risk index. And to do this, we collaborated with our partners, academic and other researchers within agencies to generate a logic model that relates indicators of community risk through established risk and protective factors to data that we can see with our surveillance methods. So data from indicators including things like depression, DUI, truancy, broadly behavioral health measures, and substance use measures informs this community risk evaluation and allows us again to get promotion and prevention services to highest needs communities. Next slide, please. Okay, so ultimately the results of this targeting to highest needs communities can be seen here. In the state, in this sort of small chart here to the right, you can see that we're looking at CPWI citing essentially locations in these little yellow dots, and this is laid over community demographic characteristics in green. What we see is that nearly 1/3 of CPWI communities are in communities in which 40% or more of children are identifying as BIPOC, which is far above the state average, and shows that these efforts, these CPWI communities, are relatively well poised to support health equity efforts. Next slide, please. So we can also use our surveillance data to look at the effectiveness of the CPWI model and the effectiveness of the CPWI model when it comes to specific substances like cannabis. What we see here is when we compare CPWI and non-CPWI communities, so non-CPWI is in gray, CPWI is in blue, we see that the increase in rates of cannabis use as folks go up in age and grade increases significantly in both CPWI and non-CPWI communities. However, we see that the increase in CPWI communities is far less than what we see in non-CPWI communities. And again, these communities are those that are, at the highest risk for, increases in use of substances like cannabis. And so what we really see here is CPWI, at least in this measure, is slowing the trajectory of increased cannabis use among adolescents. Okay, let's go to the next slide. So really beginning to dive into what is the CPWI model and how is it delivering services and programs. CPWI can sort of be thought of as a two-pronged approach. On the community prevention and on the community-based side, what we see is services emphasizing local decision-making to address local needs through locally informed data through HYS and other means, as well as involvement, community awareness, and education and policy efforts. There are also direct service programs that are a critical component of this. There's also a school-based prong, which supports universal prevention through classroom education, as well as ID, referral, and intervention to supports for selected students and school staff. Next slide, please. So in terms of actually selecting the evidence-based programs that these communities are implementing, our section has collaborated to essentially curate and maintain a list of approved evidence-based programs for selection and use by the communities. To develop this list, candidate programs were identified primarily through evaluation of several registries, as you can see them here, blueprints, as well as state registry through WISIP and other resources as well. Next slide. So to identify risk factors most associated with cannabis use specifically, path analysis was conducted in collaboration with agency researchers. Then these programs were evaluated by academic partners at both WSU and Washington, the University of Washington, in specific cannabis-focused programs and prevention-focused programs within those institutions to look at a few factors: the specificity of the intervention for the relevant risk and protective factors, the quality of the evaluation research, the impact of the intervention, and how ready essentially the program was to disseminate in our sort of Washington setup. In short, the programs on the list were shown in at least 2 high-quality studies to be effective in what they were targeting. Next slide, please. So we're finally arriving at the current list of evidence-based, research-based, and everything else-based programs that can be implemented throughout the state. In addition to this list that you see here to the right, we also have community development that is happening and is really critical to the work that we're doing. CPWI development is based on communities that care, as well as the strategic prevention framework through SAMHSA, and training in both of these has allowed for strengthening of our coalition efforts. Coalitions also engage in local policy and environmental work, helping to prevent essentially the increase in alcohol and tobacco access throughout the state, and also support mental health promotion. Let's go to the next slide. So lastly, not only have we been able to conduct research and glean information from research that shows that a lot of these programs are evidence-based and effective in achieving decreases in cannabis use or decreases in relevant risk factors. But we also have shown through work through the Washington State Institute for Public Policy, that many of these programs are also cost beneficial. So they're not only effective, but there's a return on investment when we look at the economics of implementing these programs. This is really important when we're talking about, using taxpayer funds effectively. We can see that there is a return on investment in the communities that we're investing in. Okay, last slide here. So just quick acknowledgements. This work is really a collaboration between a lot of agency partners, the Healthcare Authority, our sister agency, the Department of Health, and the Liquor and Cannabis Board, as well as several others. Our academic partners, we've leaned on very heavily to make sure that the programs we're implementing have a strong evidence base. And then thank you also to coalitions and community providers. With that, I will end because I think I'm over time, and I can take questions at the end if there's time. Thanks, everybody.
Great. Thank you so much, Harrison. This is such important information to share with the Minnesota folks who are just really kind of at the beginning stages of starting to pull this kind of work together. So I think your resources, and hopefully some of the folks can reach out to you individually and follow up for more information as well. So
Definitely.
Next up, we have Palvinder Kaur is going to talk about the experience in California. I'll hand it over to you.
Thanks so much, Rachel. And I'll build upon the pieces that both Kara and Harrison said. And instead of sharing those resources, we'll talk about the work here in California. So in California, Proposition 64 legalized the adult use of recreational cannabis and created new taxes around the cultivation and sale of marijuana and cannabis. And revenues go into the Marijuana or Cannabis Tax Fund, and 60% of that is allocated to the Youth Education Prevention, Early Education, and Treatment account, which I'll dive into where my program, Elevate Youth California, sits under. And so YPETA, or the Youth Education Prevention, Early Intervention, and Treatment account, is divided up into different sources. So $12 million annually goes to the California Department of Public Health to carry out data and surveillance activities, similar to what Harrison described of what's happening in Washington. Out of those remaining funds, 75% of that goes to the California Department of Social Services. And this is really where, early education and childcare vouchers, resources are provided as well. And then 5% of it goes into the Youth Community Access Program, which really is with the California Natural Resource Agency. And that's to support projects that serve youth and support access to natural or cultural resources. And then 20%, the remaining 20% of the YPETA account is used to fund and implement Elevate Youth California, a youth social justice mentoring and peer mentor program, which I'll dive into. And specifically, this program looks to reinvest in the communities that have been disproportionately impacted by the war on drugs. And so with the Prop 64, there was an advisory group that was formed, and this is really key to the work here in California. The Prop 64 advisory group was formed in 2017, and it was really to guide the development, implementation, and evaluation of all of the projects that are funded through Proposition 64 and the YPETA. So the previous mentioned programs, whether that's through the California Department of Public Health, California Department of Social Services, California Natural Resource Agency, or the Elevate Youth California program, that advisory group helped shape how that funding was going to be allocated, as well as the evaluation of these programs. And the Prop 64 advisory group is a requirement of the Revenue and Taxation Code. And this is really critical to ensuring that those who are providing and creating and evaluating the programs and these allocations are really committed to that harm by the war on drugs. And so our Prop 64 advisory group is comprised of volunteer health organizations, physicians who treat addiction, researchers, family therapy and counseling providers, all of those who work around prevention and have that expertise in public health and substance use. And so a bit more about the Elevate Youth California. It was a program that was launched in 2020. It's a project of the Center at Sierra Health Foundation, which is under contract with the California Department of Healthcare Services. And as I mentioned, it's funded through the YPETA account. And the key piece is really in in California, that partnership happened with the state to make sure that funds were rolled out, that a competitive bid process was done for CBOs and tribal organizations, and just ensuring that there is a commitment to the technical assistance and training for these grantees as well. And so Elevate Youth California is grounded in social justice youth development. So we really look at prevention as the broadest understanding of prevention. So tapping back into, what Harrison mentioned, really looking at increasing protective factors, reducing risk factors, time spent with young people where they're not engaging in substances is prevention. And especially when we look at communities that have been disproportionately impacted by the war on drugs. And we're happy to share that 93% of the Elevate Youth California participants are youth of color and are two-spirited LGBTQ plus youth. So really, again, that commitment to the communities that have been disproportionately impacted by the war on drugs is seen through the programs that are implemented by community-based organizations and tribal organizations. And one of the key pieces to this work is ensuring that there is, in terms of is a policy, policy systems and environmental change component, which is a key driver around social justice youth development. And so really ensuring that we're thinking about prevention, education, early intervention in the ways that communities need them. And so the ways that can happen is through grantee partners across the state. And so when we look at social justice youth development action, again, we're really thinking about policy systems and environmental change and allowing young people to serve as those agents of change. And so examples of some of the programming are youth-led organizing, student civic engagement, campaigns to address school or community concerns. We've had a number of organizations and young people who focus on, substance use policies at their organizations, disproportionate impacts that suspension or expulsion policies have on youth of color, particularly around the racist policies that exist at some of these schools and school districts, as well as ensuring that when, young people do have substances, that there's alternatives to suspension and expulsion. Why are we then, creating greater harm by having young people spending more time outside of school when they should be spending as much time as possible within school and getting their education? And then efforts to change social conditions through public policy, really looking at whether that's at the local level, statewide level, various levels, to ensure that there are longer-term systemic change. And we might not see that overnight. And our awards for our grantee partners are up to 3 years. So we really want to make sure that we're committed to what policy systems and environmental change will look like. Additionally, when we think about substance use disorder prevention, it's really, as I mentioned earlier, around all of the activities that promote healthy behaviors, reduce risk, and build protective factors. So we really rely on our funded partners across the state to develop and determine what those practices will look like and what their programming will look like. And we also incorporate harm reduction. We've seen previous prevention policies and practices that have zero tolerance, policies that are incorporated. So when young people are seen using substances, they're kicked out of programs, they're not allowed to participate. However, really wanting to make sure we're thinking about harm reduction as well and ensuring that we're reducing at-risk, moderate, and high-risk behaviors, especially, again, tapping back into the piece that Harrison mentioned around 21 to 25-year-olds or 26-year-olds engaging in substances at higher rates given the legalization of cannabis. And so how do we ensure that at that still young age, as 21-year-olds and over are able to legally engage in the recreational use of cannabis, we're able to incorporate harm reduction practices and really think about the supports that young people need. As we know that 21 to 26-year-olds or 24-year-olds are still transitional age youth, and they also need greater supports as well. And so how do we ensure that we're continuing to work with those who might have started using substances legally or illegally as well? Some of our implementation strategies include, again, youth civic engagement, and then our program has either or both a mentorship, relationship building, or peer-led support and leadership programs. So again, really looking for community-based partners and tribal partners who are ensuring that young people are leading this work and are providing opportunities for mentorship and relationship building, whether that's through adult to mentee mentorship programs or peer-to-peer mentorship and relationship building as well. For our program, we have incorporated a minimum of one youth listening session, and we found that while this is just at the minimum, it ensures that there's an opportunity for programs to intentionally solicit feedback and advice from young people directly about their programs. So again, good feedback from young people on the strategy and project implementation, and we've seen our funded partners go above and beyond the minimum one youth listening session annually. And so considering this as a focus group, ensuring that we're getting that feedback from young people to ensure that these programs are still relevant. I'm trying to speed through, knowing that we're at 11 o'clock, so we might go over here, but just trying to get through the slides to share our resources. And so as the contract administrator of Elevate Youth California, we've really honed into that technical assistance and training. And so we offer networking sessions monthly or nearly monthly. We do webinars and training around prevention, around the specific pieces and the components around our program, and ensuring that we're hearing from our funded partners about the feedback that they have and the resources and training they need. So we contract out with other technical assistance providers to ensure that they're able to get that. And we go beyond the webinars as well, because only so much is gathered through a webinar. So we also do one-on-one sessions with those TA providers, as well as small group sessions as well. So that way the funded partners can get a bit more support in regards to the specific topics and talk about the nuances in regards to their own programs. This year, we're launching our regional convening. So we have currently over 260 active funded partners in the state of California. And so we'll be looking to divide up the state in 6 regions and meeting our local partners. And again, really to be able to allow for the connections in each of the regions. And this was one of the asks of our funded partners. And in 2023, September, we hosted our first youth convening where over 700 staff members from our CBO partners and tribal organization partners, as well as young people, participated in a convening in Sacramento for 2 days of networking, connections, technical assistance, and just learning more about those programs. And in true partnership with young people, we ensured that we had a youth committee help design the convening, as well as encouraged youth workshops as well. So we prioritize workshops that had youth who were presenting about the programs that they were leading in each of their local regions and in each of their local programs. You can find more about Elevate Youth California on our website and all of the funded partners. Moving forward, we're going with 2 tracks. We've intentionally built out a capacity building track, understanding that the harms of the disproportionate impact that the war on drugs has had. And so we provide technical assistance for small grassroots and emerging organizations that have an annual budget of under $1 million. And ensuring that we're supporting those grassroots organizations, because some of those organizations are reaching and are able to reach the young people who have previously not had the resources and support that are needed. And they're also able to build their own organizational infrastructure. So they're not having to overburden staff on just focusing on the youth component, but really wanting to be in partnership with our funded partners who are small and grassroots emerging organizations. More about our program. To date, we funded $205 million through the Cannabis Tax Fund, through our specific 20% allocation over the years. And we've done 290 awards, and we're across 53 of the 58 counties with partial coverage, and some of them, again, just showing the reach that CBO partners can have when this funding is given directly to community-based and tribal organizations. And I'm going to go ahead and end with just sharing my email as well as our resources, and just trying to end on time. And so with that, I'll go ahead and pass it back to Rachel.
Great, thank you. And keep your screen on though, because I know we're a few minutes over, but I feel like with the expertise we have in the room here, I really feel the urgency to ask a question of you all, specific for Minnesota, which is in Minnesota, we're just beginning to establish our programs. And it sounds like in Washington State and California, you have so many great things you have learned, have honed sort of your approaches. If you could make any like 1 or 2 key recommendations for Minnesota as we are just beginning to, really pull these resources together and develop our prevention programs in Minnesota? What would be your top one or two recommendations that like Minnesota must consider this or must do this as you're embarking on this? So Harrison, I'll turn to you first and give Pavinder a moment to contemplate.
Yeah, so great question. I think in Washington, lots of lessons learned. One would be the sort of need to focus on threading this needle between, evidence-based programs and community-driven processes, and having communities really have ownership of what they're doing. So we've thought a lot about, how do you allow for modifications, adaptations while maintaining, proper implementation. And then another thing is surveillance has been really important for us. After a while, folks look at the dedicated cannabis account and realize there's a lot of money there. And so sometimes that can lead to shifting of money away from prevention into other things. And so having data to show that the efforts are effective and well driven has been really helpful for us.
I'll jump in and I'll echo Harrison's first point. When we're really thinking about community-driven practices, we really have to think about those who are leading this work, who reflect and come from the experiences of the young people they're working with. And California is quite diverse, not just race ethnicity wise, but other intersectional pieces too, right? Immigration, socioeconomic class, gender identity. The gambit. And so when we really think about that, it's not just making sure that the folks reflect, but also you're providing the resources and tools and that the organizations need as well. And so I think, I can probably say similar to what California is embarking. It seems like Washington has already looked at some of those evidence-based practices, ensuring that additional support is provided to community-driven prevention practices that in our traditional prevention world are not considered to be evidence-based practices, but working with them to ensure that they are. And so similarly, when we're really looking to be committed to the disproportionate impact that the war on drugs has had, it means that we're also providing that additional support. And we've been successful in California, not to toot our own horn here at the center, but really it's because we're in partnership with community-based organizations. And this has worked really well because of that contract through the Department of Healthcare Services and understanding that state agencies might be a bit slower at rolling out certain things. And so we're able to hear direct feedback from the CBO partners and even their young people. The center is also required to do youth listening sessions, a part of each of our contracts. So again, that direct feedback from CBOs and the additional support that's needed is critical. So when we're thinking about investing, in community organizations and wanting to reach those populations, that comes also with the commitment and the need to commit to providing those tools and resources as well.
Great. Thank you so much for those recommendations. And before we close, I'll just open it up to Kara and Traci. Any last sort of parting words you want to share with the group?
I'll just quickly say again that we are just getting going, but we definitely want to hear from all of you and figure out ways to build connections and get the information out to you that you need.
Thanks, Rachel. Just one final plug for our website, mnprc.org has a lot of really great resources. If you're not sure where to go or where to get started, feel free to reach out and we can point you in the right direction. So thanks so much.
Great. And thanks everyone for joining us today. It was an amazing conversation and a boatload of resources shared. The slides will be shared on as part of sharing the webinar and the website. So stay tuned. You'll be able to click through all those links there. So again, thank you and have a really wonderful week, everyone. Thank you.